I just found an article about misdiagnosis and Cushing's disease. God, you've got to be so flippin' careful, haven't you? You already have. You end up having all these diagnosis, all these, having a diagnosis with a doctor and what have you. It might be wrong. It might not be fibromyalgia. I happen to think mine is, but it might not be. Now, women, in this case, with Cushing's syndrome may be misdiagnosed with fibromyalgia, according to this article in the Cushing's disease, on the Cushing's disease website. It says, a chronic condition characterised by widespread pain, as in fibromyalgia, and mental distress. Despite showing Cushing's symptoms, a new case series report demonstrates that misdiagnosis for fibromyalgia is often the case. Well, I say often, they haven't actually any figures, but sometimes it is. Researchers say that these misdiagnoses of fibromyalgia, excuse me, I'm tired. I'll blame fibromyalgia, shall I? Occurring in a trio of Cushing's syndrome patients across 3 countries, highlight the difficulties of diagnosing women who experience generalised symptoms. But an overarching concern is that these misdiagnoses delay. Because I've been diagnosed with fibromyalgia, a more serious condition isn't getting treated, that it might be treatable. Ooh, that's not good, is it? So prolong the time until they can actually get any symptom relief. Now, these cases underscore the challenges in differentiating Cushing's syndrome from other conditions. What about post-COVID? Many people suffering post-COVID. To me, it sounds very much like fibromyalgia. Now, particularly when presenting the non-specific symptoms similar to fibromyalgia, the researchers wrote. All 3 women received misdiagnosis of fibromyalgia, and Cushing's syndrome comprises of a group of disorders characterised by the presence of excessive levels of cortisol, which is a hormone. That's interesting, because hormone imbalance is something that can trigger fibromyalgia as well. So you can understand why there's potential misdiagnosis. Interesting. So it's a stress hormone, so it says here, that's produced by the adrenal glands. In many cases, it's caused by a tumour in the brain's pituitary gland. I can't say it now. I don't know if you realise this, but my vocal cords are bugged as well with fibromyalgia. I'm sure I am. I used to have a high-pitched voice. I used to sing like an angel, I did, and that's horsey, sort of like raspy. So, so it's often caused by a tumour in the brain's pituitary gland, which produces high amounts of adrenocorticotropic. Oh, I can't say that. Let's try again. Okay. Adrenocorticotropic. That's a very long word. It's got, my God, 5, 10, 15, about 18 letters in it. It's a very long word. Anyway, no, not 18 letters, it's got 13 letters in it. 13, 14 letters. Anyway, it's a very long word. But a hormone. But if you think about hormones, say, like for instance, the thyroid produces a hormone, but it needs another gland that produces a different hormone first, for which then the thyroid converts into its hormone. I can't remember which one it is now. So all of the glands in the body that produce all these hormones rely on the hormone-producing gland that was there before them. So if you've got a problem one, it can cause problems elsewhere, you see. Anyway, a signalling molecule, apparently it's hormone, yeah, a signalling molecule that promotes cortisol production. In other cases, patients have tumours in the adrenal glands that directly increase cortisol production. When the source of the problem is pituitary, oh God, it's for dogs. Pituitary gland, oh crikey! Anyway, that gland, the condition is known as Cushing's disease. But the symptoms are very similar to fibromyalgia, but it could be a tumour. Ooh, oh dear. I think we all need to be very, very, very careful. Okay, these tests have been done in women because, quite frankly, more women suffer with fibromyalgia than men. That's just fact. Poor buggers, and they seem to get it worse. Because although I do get a lot of pain, my wife's cousin's wife has also got fibromyalgia, and she lives in Australia. She's visiting her parents at the moment, his parents at the moment in the UK, and her parents. They're both British, and she can't function. She's like, she has to literally go to bed for about half the day. She does a bit in the morning, and she's in such pain. It's horrendous. You know, some people get really bad. Mine's nothing like that. You know, I've got my problems, but it's nothing like some people get. Some people get horrendous. Obviously, I feel for that. I feel for them because it's pretty awful, isn't it? You know. And it doesn't help when you get individuals who say, "Oh, that's just in your head and what crap," you know, because it's fibromyalgia, because they can't necessarily see. Something, you know, you've got a leg missing or something, they can't see what the problem is, they think it's just all in your head. It's flipping crazy, no, it's not. No, it's not, I'll tell you. Crikey. So, yeah, misdiagnosis is a very real risk. It really is. Anyway, thank you for watching my little video, especially if you got to the end. Please put the like button, maybe subscribe to the channel, because I put up regular videos. I'm also putting up short videos as well. But I'd like to try and do more on the long form, really. Gives me a bit more time to, talk about it, I suppose. Try and put the information across. Hope it's clear as well. But we'll see. I'm not that good at speaking anymore anyway, so that's a bit of a struggle. But there you go. Say la vie. Toodaloo.